Now, some researchers have expressed grave concern about how many children less than 16 years are having sex these days. According to the researchers, the development is leading to many unsafe abortions by these teenagers. They have been speaking at an event organized by Curious Minds. The research revealed that 70% of 1,031 persons interviewed in Cape Coast and Elmina during the research have engaged in abortion, with a disturbingly high proportion of the percentage being girls below 16 years. Dr. Nii Ajayi-Soa, who was part of the team that led the research, stated that the research showed more younger people start having sex before the age of 16, and when these sexual encounters result in pregnancy, they are forced to opt for abortion.
Actually, what we found is largely the interplay of a lot of factors. It's not just one thing, a number of things. It stems from social issue, how our social fiber or our cultural fiber is gradually, I won't say it's collapsing, but it's loosening. And how also religious beliefs and practices are influencing people's decisions and action. So largely, we found that more younger people are going to sex very early. So early sexual debut. So people are having sex before they are 16 years. And because of that, a lot of them are also getting pregnant that they don't want. So because of the unwanted pregnancies, people are forced to also engage in abortions, which are mostly unsafe, because they resort to different methods. So going to unauthorized facilities, getting people who are quacks. So people doing abortions in drugstores, doing abortion in their homes. And one of the things that we found that was very worrying for us is where people resort to certain kinds of medication to terminate unwanted pregnancies. And this is something that as a country we have to start talking about and start addressing, because a lot of these herbal remedies, these malaria medicines, are all used for abortions. And when they advertise and say that a pregnant woman must not drink, they are implicitly advertising themselves. So then you find a lot of young people going in for this methods to terminate pregnancies that they don't want.
The coordinator for the children and youth in broadcasting of Curious Minds and a member of the research team, Kingsley Obinchere, highlighted concerns raised over reproductive health matters in the country and called for effort to control the rising number.
Reproductive health concerns have become a challenge for us as a nation. And even when we were talking within the sphere of the world at 8 billion, one of the cases or questions we kept coming back to was the fact that, is that going to be a problem for us? Are we going to tap into it? Then it means that we should have firm control of the numbers that are coming. And if we talk about control of the numbers, one area that we shouldn't lose sight of is the fact that teenagers are getting pregnant, and they are not planned pregnancies. Immediately, we start asking, what happens to us in terms of our development?
A member of Curious Minds, Benedicta Ayi, shared her thoughts on the research and mentioned some ways to address abortion issues in the various communities.
And most of the communities that they did the research, most of the ladies don't engage themselves in safe abortion. And during occasions, parents relax on controlling their kids. So therefore, I suggest that parents or guardians should educate their kids on sexual education, because it seems that sexual education is irrelevant or something bad to the kids.
The research was conducted by Curious Minds, a non-governmental organization in partnership with Swedish Association for Sexuality Education. Now, Bishop of the Damango Diocese, Most Reverend